gathering some basic information about your health. This includes checking your blood pressure and pulse. Next, I will gently feel around your head and neck with my hands. And lastly, I'll take a look inside your mouth, specifically your gums and your teeth. Is this okay?
Yeah, okay.
Okay. For your blood pressure and pulse, I will be using this equipment. I will put it on your arm and you will feel some tightness, which will be the only risk. But you'll only feel the tightness for a short period of time. Gathering this information will allow me to treat you in the most comfortable and safe way for you. There are no alternatives for this procedure.
Sounds good.
When I feel around your head and neck, I will simply be checking to feel if there are any irregularities or tenderness. So if you feel any pain, it shouldn't cause any discomfort and it will only last a few seconds. It'll be a quick examination.
Okay.
When I look inside your mouth, I'll be using this instrument called a probe to measure the health of your gums. It's not a sharp instrument. I will place it against your tooth and slide it gently just a few millimeters below your gums. You shouldn't feel it at all. There shouldn't be any discomfort. It will take a little longer because I'll have to do it for each tooth individually.
Okay.
This instrument is called an Explorer, and it will be used to detect anything on the surface of your teeth, which is especially good for the areas that are hard to see or reach. And it'll allow me to have a better idea of the overall health in your mouth and what areas may need more work or focus. Has everything I said up until now made sense?
Yeah, I understand.
Perfect. All the information I gather today will be put in your medical history chart and will be used for your future appointments. If I have any concerns or if I see any problems, you will be informed right away.
Okay.
None of these procedures will add any additional cost to your visit today because they are all part of a standard assessment. However, if the information I gather from these specific procedures that I've just explained to you, if they don't give me all the information I need, you may need to be prescribed radiographs.
Can I refuse the radiographs?
Yes, you have the right to refuse a radiograph. However, if we are unable to gather all the information we need, we won't be able to treat you.
Okay.
Do you have any questions or concerns before we get started?
No.
I know that was a lot of information to take in, but I will explain each procedure in more detail as we get to it.
Okay.
Is it good? Now I will be using my Explorer to detect any plaque buildup or the presence of cavities on all surfaces of your teeth, including underneath the gum line. Because I'll be touching your gums, it is possible that there could be slight bleeding.
Hearing that you're going under my gums is kind of making me nervous.
Can you tell me more about how you're feeling about this fear?
It's just making me feel very uneasy. Are there any alternatives?
If you don't want me to use my Explorer, I could use a disclosing agent on your teeth instead. It's a liquid that will allow me to see the plaque on your teeth by staining it. It would only stain the plaque. It wouldn't stain any surface that's clean. However, I still wouldn't be able to see the plaque below the gum line, which is what I'm looking for as well. So I would recommend the Explorer.
Okay, I'll give the Explorer a try. Is it okay to stop at any moment if I feel any discomfort?
Yeah, for sure. Just let me know.
And does this add any additional cost?
No. Like I previously stated, this is all part of your assessment, so there will be no additional cost. All right, now I'll be moving on to probing. Again, there will be a possibility of slight bleeding, but what I'm doing is essentially measuring your gums and how healthy they are.
Okay.
Unfortunately, there is no alternative for this procedure, but as previously mentioned, there will be no additional cost because it is part of the assessment.
Okay, wonderful.